Speaker Johnson has called the Affordable Care Act enhanced premium tax credits a boondoggle. But let me tell you what those tax credits have meant for millions of Americans. Over 80% of the tax credit goes to help working people in states that President Trump won. Since they were introduced, more than half of the growth in national enrollment has come from Texas, Florida, Georgia, and North Carolina. And who are these folks? They're not the 29-year-old sitting in his mother's basement playing video games. They're restaurateurs, beauticians, landscapers, mediators, chiropractors, funeral directors, farmers, ranchers, freelancers, contractors, gig workers. And now they're stuck. As open enrollment began and they opened their mail, they found that their premiums in some cases doubled, in some cases tripled. I heard from a local restaurateur in my district, Lester Johnson. He and his wife own Mama J's, a beloved restaurant in the Jackson Ward neighborhood of Richmond, which was once known as the Harlem of the South. The Johnsons rely on Obamacare or the Affordable Care Act for themselves and their 8-year-old daughter. They pay $700 a month, and Lester has estimated that if the subsidies expire, his bill will go up to $1,400 a month. He has about 40 employees, and they would see premium hikes as well. And Lester says, it's a lot of money for people. I think everyone is feeling the anxiety. He's worried about his family and the families of those 40 employees. I heard from Braun Hansborough, the owner of Flower Guy Braun, a Richmond small business. We've been looking at this coming down the pike for a few months, and I've had to be proactive, and I've had to consider what it looks like for my business if these credits are removed. And what it looks like is taking an increased risk and finding money that doesn't exist to make sure that we can supplement and offset the cost of my sole employee's expenses. His sole employee is Ronnie Moss, who said, I found fulfillment in my part-time work as a floral and event designer with Braun. In 2021, I left my corporate job for a full-time employment. It was an important move for me to work in a dream career while contributing to the success of this small business. At reasonable rates, I've purchased health insurance on the marketplace, and the benefits that they've offered at my corporate job, while they allowed me to give birth to my handsome son, it's the marketplace that has proved more valuable to me. And now the increased insurance, on top of the increase in groceries and other living expenses, I'm not sure how my family is going to manage it. We've heard from farmers across the district who are already struggling, particularly soy farmers. And in my district in Virginia, we have some of the largest number of soy farmers in the Commonwealth. They're already struggling under the tariffs, that as a result of they can't sell their crop. One of my farmers said to me, basically, unless you're a beef cattle farmer, you're already a volunteer right now. And now we have to figure out not only how we feed our families, but how we pay for our health insurance, because we purchase under the marketplace. Why is it so important that people are insured? I was in the Virginia legislature when we expanded Medicaid under the Affordable Care Act. And the reason we did it was because we had rural hospitals that were about to close. We had so many people who were not getting preventative care, and it was leading an already bad maternal health crisis to get worse. It was leading an already bad infant mortality crisis to get worse. It was leading a preterm birth crisis to get worse. But by getting people connected to a medical home, paid for by insurance, in that case Medicaid, or later when we created a state-based exchange through the exchange, they could get preventative screenings that could identify cancer while it was still treatable. Pregnant women would be healthy when they got pregnant and not have to deal with hypertension and other chronic diseases that lead to a high maternal mortality rate. We saw health outcomes improve. We saw hospitals that were on the verge of closing because of the high number of insured overcome that risk. During the summer recess, I visited a dental clinic in far southwest Virginia, in Abingdon. Before that dental clinic opened, communities in southwest Virginia waited a full year for a dental clinic as part of a larger healthcare clinic to come where they could get basic dental care, dentures, and other types of dental care. When this clinic opened, 80% of their patients are Medicaid recipients, 20% are uninsured. Now, thanks to the pending Medicaid cuts, they don't know what they're going to do. They're worried about the uninsured in that community who are covered by Medicaid. And now that community is also worried about those that are insured through the Affordable Care Act. Because without your health insurance, you don't know what you're going to do when in the blink of an eye, your child is injured. I know that fear. When my son was about 3 years old, in the blink of an eye, he burned his hand. I happened to be in a rural area as part of a conference. We went to the local hospital. They didn't have a burn clinic, and they said, you can drive back to Richmond. This was on a Saturday. They said, you can drive back to Richmond, and on Wednesday, there's a dental clinic. A burn clinic. And they can take your son, or we can see if we can get you admitted to UVA Hospital or VCU Hospital, both of which were hours away. But we can see if he can get admitted right now. I said, we're going to see if he can get admitted right now. Between the ambulance ride, a week in the hospital, and the treatment, because I had employer-provided health care, I still had to pay $1,000 out of pocket. The total bill was $15,000. This was 12 years ago. Think about what that bill would be today. But I was fortunate because I had employer-provided health insurance. I only had to pay $1,000. But I think about how many people don't have that. And Medicaid or the Affordable Care Act is their only option. Right now, they're worried about whether that option is going to be available. And so what does that mean for the people that I represent? In Virginia, about 350,000 people benefit from the premium tax credits, enhanced premium tax credits. For a family of four that earns just under $130,000 a year, they will see their premium go up 43% to $4,675. For a family of four who earns $64,000 a year, their premium will go up 20%, $2,571 more that they have to pay for insurance. For a 60-year-old couple earning $82,000 a year, they'll see their premium go up 174%. Their premium will go up $11,968. Most of the families I talk to don't know where they're going to find that money. They don't know if they're going to be able to pay that premium. They do know one thing. Guaranteed they're going to need health care. They don't know if they're going to be able to pay for it. We will continue to raise these stories because too many people are depending on Congress to act. Their lives literally depend on it. And hopefully, before December 31st, we will find the political will to extend these tax credits. If we don't, we better come up with a solution to ensure that Americans all across this country can access the care they need when they need it. If we don't, how are we going to look them in the eye and say we served their needs? I worry about that. I worry about that mother who wakes up one morning bleeding, 9 weeks away from her due date, who goes to the hospital and isn't sure how she's going to pay, if she makes it, that bill. I worry about that mother whose child has to stay in a NICU for 6 weeks, who doesn't know how she's going to pay that bill. I worry about that mother who has to figure out, how am I going to get my child the developmental care that she needs to ensure she meets her milestones? Because all that costs money that she probably doesn't have. And that mother could have been me. But I was fortunate that I had insurance. And while I worried about whether my daughter or I would make it, I didn't have to worry about how I would pay for it. There are too many Americans who go to bed at night wondering, is that lingering cough something that I need to go to a doctor for today? Can I afford it? Or do I wait until I can't breathe and I'm in the emergency room? That's what's at stake. It's not a game about will Democrats or Republicans win. It's a question about whether the American people can get the care they need when they need it. And the Congressional Black Caucus will stand up every single day and fight, not just for our constituents, but for every single American, whether you live in an urban core, a rural holler, a suburban cul-de-sac, no matter where you were born, although we know, let me clarify, that if you're not a citizen, you're not eligible for the ACA. Let's just put that to bed for a minute. But no matter where you were born, where you live, the color of your skin, how you worship, you can get the care you need when you need it and know you won't go bankrupt. That's all people are asking for right now. And we're going to fight to make sure every single American can go to bed at night not having to worry about the answer to that question. So I thank you for your attention tonight. I ask you to come together to find a solution to this crisis. And with that, I yield back.